listening to this and also have a lot of takeaway for us to go back to our countries and go back to our institutions, take care of it. Now, with this note in mind, I would really like to welcome with a hearty welcome to three important speakers today. We have with us Jerry Nosovska, chairperson of the British Association of Social Workers, who has been very kind to agree to deliver a keynote address. And I'm really looking forward to, I'm sure all of us are looking forward to listening to her. Second speaker will be Mr. Marcus Riley, Chief Executive Officer of Ballycara, Australia. Where, in Brisbane, I happened to visit his homes in Australia. He's another person who has got a lot of experience as being a Chief Executive Officer. He's going to probably share with us his perspectives on what the role of social workers in such institutions that similar to what being run around the world. And last one is we have Englyn Lisa Chen. She's a faculty member in social work, University of Sussex. She has got very specific interest in aging, and probably I will keep that option open, and she's going to really talk about this. And all these three speakers today would have 25 minutes of speak and 25 minutes to talk, maybe a few minutes extra, we have no problem. And Dr. Raja Samuel, principal of the Madras Social Work, has kindly agreed to chair the session. He will introduce the experts to the audience. Now, before I really close, probably a few housekeeping announcements I would like to make. Number one, our programs on 28th, 29th, and 30th July will commence at 11 o'clock Indian time. And on 3rd, 4th, and 5th August, it starts at 5:30 p.m. Indian time, which is 8 hours in the morning EST. I would request you, all of you, bear in mind all the time, please remain muted. We have to listen to the speakers. Those of you who are not muting, please mute. It'll be difficult for us to keep following up on because several hundreds of people are participating in this program, so it's difficult for us to keep muting them. We would request you to do that. The third thing is, kindly use the chat box to express your views or seek any clarification. I think the chairperson of the session would try his best to pick up those points if time permits and able to access them. We will try to answer as many questions as possible. We would be very happy to get back to you later on in case we are not able to answer it today. Get back to you with the response a little later. Please understand, chat box is meant to discuss about what is happening today. We do not want any other discussions taking place in chat box other than the subjects being discussed today. We would not want any distraction to the participants as far as the other points are concerned. And I request, I think at the end of the session, we would, after all the sessions are over, stay back to respond to our feedback. Feedback is the only basis on which we will be able to give you a certificate of participation signed by all the participating institutes, which would, be a big recognition for your, for participation. And finally, the question and answer sessions, if we are able to address a few questions, if time permits, if the speakers are in a position to talk to you, we will be able to really facilitate. We will be delighted to do that. And I request all the participants to join me in welcoming the experts by using the reaction button in your, Zoom. Reaction word says, it claps and it gives you a celebration. It gives you various, points. Any of you can use it to welcome all of them. And with this, I welcome all the three speakers once again and request Dr. Raja Samuel to take over the session from now onwards. Welcome, Dr. Raja Samuel.
Thank you. Thank you so much, Dr. Ganadharan, for this very good introduction about the overview of the program. And dear participants and guests and experts, I am really delighted to host this particular session for today on the challenges for social work in the care of elderly. As you all know that it's an important topic. Just last month, a couple of 30 days back, we had a very interesting series of webinars again organized by Dr. Gangadharan on abuse of elderly. I think a natural follow-up sequence should be how is that to be tackled? And I think here in this series of webinars, we are going to look at probably the solution for it and how social work can really bring in a good solution, a durable, long-term sustainable solution for the problems of the elderly. So that's the focus, and a very warm welcome from all the participating institutions. On behalf of all the participating institutions, I extend a very hearty welcome to the three resource persons who are going to share their wisdom with you. But before I go on to them, several of you know probably Dr. Gangadharan, but since a huge number of people have joined, some of you would not know about the host of this particular series of programs. Dr. Gangadharan established India's premier geriatric medical facility, Heritage Medical Center at Hyderabad in 1994, and simultaneously started a lot of training for poor youth on bedside care for elderly. And he also got involved in the Ministry of Social Justice and Empowerment in 1995. And from that point onwards, he has been involved in the policy for the aged, and he has been nominated to several committees, and particularly this particular legislation of maintenance and welfare of parents and senior citizens. He was involved in the formulation of the legislation, which is a landmark legislation for our country. And he has also served in several committees constituted by the government. And as a part of through in National Institute of Social Defense, he has conducted a huge number of programs on creating awareness about the care for elderly across the country. And he has also served in Andhra Pradesh government's State Advisory Council, and also as a part of the National Human Rights Commission, and served as a board member of international organizations such as International Federation on Aging. And so just to go on to say that he is the right person to host this particular conference. A warm welcome to you also, Dr. Gangadharan. Though you are the host, it's an honor to welcome you. At this point, I'm delighted to introduce the keynote speaker of this particular conference, Ms. Jerry Nosovska, who is the founder and director of Effective Practice, which supports organizations to improve social care. She works with practitioners, managers, and leaders to develop practice. She also co-presents the Helpful Social Work podcast. Before working in practice improvement, Ms. Jerry was a service manager, team manager, and social worker in community and integrated teams for older people in England. Currently, Ms. Jerry is the chair of the British Association of Social Workers, which all of you know that it's a professional association for social work and social workers in the UK, which provides a lot of support to social workers and leads on development of the profession in the UK and advocates for social justice. Obviously, a very important requirement for particularly the care of the elderly and justice to the elderly. So with this, very warm welcome to the keynote speaker, Ms. Jerry Nosovska. Over to you, Professor Jerry.
Thank you very much. I'm really delighted to be here, and my congratulations for organising this wonderful international webinar. I'm currently in southwest England in a place called Cornwall, and that is at the very bottom of the United Kingdom. So quite a long way from you. And I think it is wonderful that we can join together from all these different countries to talk about such an important topic today. Thank you for the introduction. I'm going to share my screen, and I will just take a moment to make sure that this can work okay. I think I'll need to be given permission to share it.
Jerry, you got a permission to do it. Yeah.
Thank you very much.
Okay.
No, it doesn't seem to work for me.
Don't worry, don't worry, don't worry, don't worry. Let it. Prabhakar, are you going to help him? Yeah, we'll just hold it. Yeah. These are all the hiccups that we have initially. We'll settle down. Yeah.
Sir, can you make me co-host, sir?
Yeah, I thought you were already there, Prabhakar.
It's not having.
1 minute. 1 minute. Let me see. Where is Prabhakar? 1 minute. Jerry, I'm sorry about this inconvenience
No
for
problem.
a minute. Yeah, just a few minutes. Yeah. In spite of all that, Prabhakar, I made you already a co-host. I'm not seeing your face here once again. Where are you? 1 minute. Now 1 minute. It's Are you getting it, Prabhakar, now?
No, sir.
So what is wrong here? 1 minute. Now, I'm sorry about this, the participants, few minutes. Remove the
Straight away make
spin.
Jerry the co-host.
No, I think 1 minute. That's what I'm telling to see. She's also made a host. That's what I'm trying to understand where I'm missing her.
Not yet, sir.
Jerry.
So my name has come up as Geraldine, which might
Yeah,
be
it's
more
there.
confusing.
I'm seeing your name. I'm seeing your name. I'm trying to understand where is the difficulty that we are incurring, because we have been having, even yesterday we had a big event. I'm trying to understand what is happening suddenly. Screen. Jerry, I'm able to see Jerry here very much. Prabhakar, just to tell me, where is it? I need to know. She's in the participants list. I go there.
So go there and right side, there is an icon called More.
Huh?
You can click on it and then make co-host.
No, the question that I have is, there are only two questions I'm having. One is pin and request camera control. Can you just see? Can you now? Wait, it says, can you just check now, Jerry?
Yes, let me look.
Not yet.
No?
No, I still cannot.
Okay, Prabhakar. Screen sharing, 1 minute. I'm extremely sorry about this inconvenience. 1 minute. Okay. Prabhakar, it says it is disabled. So the question is, where do I go and do it? I'm not so familiar with that yet. That's bad. That's really bad.
You make me go, sir. You make me
No, Prabhakar, no, I don't have an option. It's not showing any option to me here. It is not showing me any option here to make her the host. I thought morning I checked, everything was all right. Now I thought I will at least show her the screen. It says for me also it is removed. For me also it is disabled. Okay, now hold on for a
check it
minute.
on
Let me.
your second device.
Huh?
Check it on your second device. You are using.
Yeah, the question that check it on. Sorry.
You are using mobile and desktop now, sir.
Let me see whether I can. What an inconvenience
I
in the
would be
morning
able
here.
to speak. I will be able to speak without the presentation,
I
and then
know
maybe
that,
share it
but
afterwards if we need
that's
to.
fine. Yeah, carry on. I will tell you. Kindly start. My apologies.
Thank you. So that was a very lovely introduction that I had. And the main things that I wanted to say are that my general experience relate to promoting the rights of older people, advocating with and for older people, and using evidence to try to improve practice with older people. But to sum up, I'm here because I am passionate about social work with older people. And as an example of why.
Can you now try? Sorry, Jerry. Can you now try it?
Oh, yes, of course.
My apologies
fantastic.
for interruption.
No, this is wonderful.
Thank you.
So as an example of why I am so interested in social work with older people, when I was a newly qualified social worker in England, I was working in a hospital in Rugby, which is my hometown, and where rugby football was invented. And I went to visit a woman in hospital, an older woman who had come in with a fall and was quite unwell. And I was worried as a social worker about her going back home. And she said to me, when I was your age, I used to drive ambulances during the war in London when there was bombs, and I think I can manage to go back home. And that's why I love social work with older people, because older people have life experience, stories, wonderful stories, and wisdom that we can all learn from. So what I want to do today is to advocate for social work with older people as a specialism, and to share learning that might be useful to our global community of social work. And so I'm going to talk a bit initially about what social work with older people looks like in the United Kingdom, particularly in England, and then identify some of the major themes that I think are emerging or developing rapidly within older people's social work, and conclude with some thoughts for the future about how we can work together to strengthen social work with older people. I have to say a thank you initially to the Gerontological 8 or G8, who are social work academics based in England and act as ambassadors in our country for social work research and practice with older people. And these are their names on the screen, and particularly to Alison Milne, who provided me with a lot of the data about older people's social care and social work for today. So to set the scene in England and in the United Kingdom, generally we talk about older people as people aged 65 or over, but most of the people that we work with in social work will be in their 80s or 90s or older. The number of people aged over 65 has risen by 21% in the last 10 years. The fastest growth in the older population is those who are aged 85 or over. And we expect in about another 10 years, 15 years, for those people to be 5% of the population. We have around 1/10 of the population living with 3 or more long-term conditions, so a complex mixture of needs. And we have getting on for 1 million people who live with dementia, and that number is increasing, of course, as well. We have a large number of carers who look after family members, and about 1/3 of those are older themselves, and many of them have their own health problems. And we have increasing diversity amongst older people. More people who live alone than previously did, a growing number of older people who haven't had children in their lives, so are aging without children, a large number of people who are diverse in terms of their ethnicity, their sexuality, and of course their interests and their culture. We have a huge amount of inequality in the United Kingdom, and an example of that is that a man who's born in Glasgow in Scotland can expect to live around 14 years fewer than a man who's born in Kensington and Chelsea in London. And in 2020 in the United Kingdom, nearly 2 million older people were living in poverty. So the United Kingdom has the highest rate of pensioner poverty in Western Europe. So within this population, social care, which is the umbrella for all work with older people, including social work, tries to promote well-being. That is its purpose, and we have a Care Act from 2014 that sets that out. The Care Act says that local governments should provide services to prevent needs where they can, that they should work closely with health, housing and other organisations, that they should provide information and advice to older people. And all of that is designed to be preventative. We also have a duty to assess people who may need care and support, and to assess carers, and then to look at whether they might need funding or services arranged by local government. If that care and support is arranged, it can be done either by providing a service or by providing money to people. There's an important element of the Care Act around safeguarding, which is new. In 2014 was the first time that safeguarding came into English and Welsh legislation. And that means that there's a duty to make inquiries if somebody might be experiencing abuse or neglect, and then to act on that. And we also have a Mental Capacity Act, which came out in 2005. And that means that if someone may not be able to make a decision, we would make sure that we make a capacity assessment. And then if they don't have capacity for that decision, we'd make a decision in their best interests. And there are various safeguards that go along with that to ensure that people's human rights are protected. Now, the picture in social care in the United Kingdom may be similar to the picture for some of your countries. There is a pattern of increasing need, as you'd expect with an increasing older population, living with complexity, but there's also a pattern of falling state spending. Since 2010, the number of older people who receive local government funded care has fallen by a third, by 36%. And 20% fewer carers received an assessment of need 2 years ago than they did about 6 years ago. It's believed that there's a large number of older people who are not receiving help with essential daily living activities. Generally in our country, people live at home. Only about 5% of older people live in long-term care. So community-based care is the central pillar of our social care system. And 90% of services are provided by the private sector. The state-provided support is very small. And generally, people pay for their own care. That's the trend. And in England, it's means tested, so that's why that would happen. Some other parts of the United Kingdom, there is funding. So in Scotland, you can have personal care free at the point of use, similar to our National Health Service. Well, so within this picture of social care, what is it that social workers do? Well, only 5% of our social care workforce are professionally qualified as either a social worker or an occupational therapist. And we social workers work very closely with occupational therapists. Social workers tend to work with people who have higher levels of need and more limited resources or social support, including advocacy. People who require, therefore, more of a complex set of care and support, often with coordination between different services. We're also often involved at the point of crisis, people who have been managing and then suddenly need support. And the social worker will provide the same support as a local government social care worker, somebody who was not qualified as a social worker, but in those more complex situations. So we would provide assessment or inquiry if it's safeguarding. We would make a professional judgment about the care and support that people might need or other things that would help them. We coordinate with the different organisations. And we also have the potential that I don't think is realised enough to provide therapeutic input. And that's an area that I do believe social workers can explore and develop much more. So having talked a little about what social work does and what social care looks like, I want to make the case for social work with older people as a specialism. Now, social work is a single profession in the United Kingdom. And there is core knowledge, skills and values across all areas of social work. However, for people working with older people, the core skill set that all social workers have is enhanced by an additional set of specific capabilities. And those capabilities are needed for 3 reasons. The first reason is that older people's situations develop through their life. And older age, therefore, often brings complex situations. The second reason is that inequalities that people face in their life deepen and widen across the life course. For example, poverty or poor housing, the effects of that are compounded over a long life. And the third reason is age discrimination and the way that that interacts with other areas of inequality, for example, ethnicity or gender. That impacts on older people's ability to access appropriate care and support. So here we have a quote from an older person who was contributing to work in England to develop capability statement for social work with older people. And this person said, "It is important that it isn't assumed that anyone can work with older people. Older people deserve to have someone with the right knowledge and skills working with them. Now, some of that knowledge and skills is the same as for working with other people, but there are some specialist elements, and I wholeheartedly agree with that." So what are those specialist elements? Well, within our capability statement in England, we looked at what older people thought, and then we looked at the professional capabilities framework and identified the specific additional elements for working with older people. This is what older people said. It's about knowing where people are on their life journey. You need to understand loss and change. You need to know about how the world works now and help older people to relate to that. You need to see strengths in older people, the wisdom and the experience that they have. You need to be an effective networker because there's often many people involved. And you need to keep a sense of hope and optimism and communicate this to others. And when we translated some of that thinking into capabilities, these are some of the big things that came up. So social workers need to apply the United Nations principles for older persons, the rights that older people have. We have to understand age discrimination and how that affects people who are very diverse in the older population. We need to use the law to ensure that older people have what they're entitled to. You have to understand aging and all the facets of aging. And you have to understand your own relationship with aging, what you think about it, how you feel about it. You need to grasp the complexity of older people's lives and see that as a positive. It's important to work in a strength-based way, and I'll talk more about that in a bit, and to work with the whole range of an older person's networks. And you need to advocate for older people and talk about not just their needs, but their hopes and their wishes. And also a social worker working with older people needs to be a champion for that area of practice and be able to explain what it is that social workers bring to work with older people, to be able to talk about that to a doctor, to a nurse, to a therapist, to the public, so that that role is recognised and supported. So what difference do social workers make to older people? Well, we don't have that much evidence in the United Kingdom of effectiveness of social work, but there was a really useful report done in 2016 about the impact of social work with adults. And what that found was that social workers have an impact, particularly in those areas of complexity. So particularly effective in working with people with complex needs. And these groups here, people receiving end of life or palliative care, older people who are facing losses and changes. So for example, a bereavement or the potential that they might lose their home and need to move into a care home. Within that, people facing a transition. So that might be someone who's gone into hospital and is trying to get back out of hospital. And also people who face a high degree of risk. And that's partly about managing the risk, but it's also about advocating for older people to be able to take risks for positive outcomes. So having talked about what social work with older people is and how it can be in the United Kingdom, and I want to talk about some of the key themes that I see in social work practice with older people. Firstly, I want to highlight the importance of legal literacy within social work. If we think about social work with older people as promoting rights and ensuring people get their entitlements, then we need to know the law really well. Social workers in the United Kingdom particularly need to know the Human Rights Act. They need to understand the Equality Act and equality legislation, and then use their local law and their local systems and policies to gain the support that people need, and particularly to make sure they have advocacy. And within our country, COVID-19 has highlighted the inequality of experience that older people have faced and how their rights can potentially be neglected or forgotten. So, for example, my organisation, the British Association of Social Workers, has had a campaign running across the United Kingdom to ensure that social workers can get access to people living in care homes, so we can go and see them and we can advocate for them and make sure that they have all they need. Secondly, it's really important to use strength-based approaches in social work with older people. Strengths-based approaches are about recognising the strengths that people have, the networks that they have, the communities, the history, their story, all of these things that bring positive opportunities to older people. Doesn't mean that we forget the struggles and the barriers that people face. So it goes alongside recognising oppression, but it is about really understanding the aspirations of older people and the way that they can achieve those things. I think one of the big elements of this is positive risk enablement. So enabling people to take risks that they would at any age in order to achieve benefits for their well-being. For example, somebody living with dementia going for a walk every day. And there's an element of this around safeguarding too. We want to make sure that people are protected from abuse and neglect. But if somebody is experiencing that, we need to talk to them about what outcome they want and how they can keep themselves safe with support, rather than wrapping them up and protecting them in a way that means that they miss out on some things in life. The third big element is integration. And there is a massive emphasis on integration across the United Kingdom, primarily with our National Health Service, but also with housing and with the voluntary sector. Social workers increasingly work in multidisciplinary settings. I worked in a hospital in a multidisciplinary team, and then I worked in a community team with therapists and nurses to try to respond to people who might need to go into hospital and prevent that. We have social workers working in hospitals. We have social workers working in general practitioner surgeries, which is the community doctor's surgeries. And social workers can really highlight the importance of the social model within those settings. So they can advocate to the health colleagues about recognizing the barriers that people face in society, and not just thinking about medical needs, but thinking about social determinants of health and the way in which our social context impacts on us. And social workers' role as a coordinator for people with multiple long-term conditions has been recognised by our National Institute for Health and Care Excellence. And it's one of the recommendations that people would have somebody to coordinate their support, and that person could very well be a social worker. The fourth element is about increasing equality, diversity and inclusion being needed within social work with older people. And this includes not only a recognition of ageism, but also a recognition of the really diverse life stories and life experiences that our older population have, and the increasing global nature of our aging population as well. We have people from all over the world. And so for me as a social worker, when I started out, I was working with a lot of people who had experienced the Second World War, who had moved here immediately after that. We're now working much more with people who came in the 50s and the 60s as migrants. We need to recognise life course events that mean that people who come into the ageing population will have particular experiences and stories that they might need support with, but they certainly would want understanding of. And finally, there's a growing emphasis on the use of digital technology. And last year in the United Kingdom, we produced digital capabilities for social workers. Digital technology has the potential to uphold older people's human rights, including helping them to have better quality services, different kinds of services in their home, ways of protecting them, building connections and tackling loneliness. But there are some real issues around ethics, making sure that we don't lose human contact with older people, making sure that people have equal access to technology, that they have choice and control over what kind of technology is used, and that our technology doesn't inadvertently discriminate by being suitable for some people and not for others. And so we social workers need to really understand older people's online life and how they can be part of a virtual world as well, what their preferences are, and how technology can support them to achieve outcomes. So to finish, I just want to talk about where things might go next here in the United Kingdom and also internationally. In the United Kingdom, I believe we need to firstly recognise the importance of social work with older people and recognise social work as a particular specialism within social care. Social care is a huge system. Social workers are a small part of that, but they are a really important part that we need to be talking about. And we need to solve the resource problem. As we have more older people, we need to have dedicated resource from the government and maybe from others to make sure that the system will work for them. And that, I think, needs a new social contract, a new agreement about what older age will look like and how we will make sure that we have the resource to achieve it. We also need much more understanding of the impact of social work with older people. And so research and evidence is needed. And I'm about to be involved in a research project here in England for 2 years, looking at what social workers do when they spend time with older people and what difference that makes to well-being. I think a lot of our practice will improve if we put the United Nations rights of older persons at the heart. And that is written into the legislation, the law in Wales. It's not written into the law in England, Scotland, or Northern Ireland, but it's a really helpful thing for us to work with. And then here and abroad, we need to globally develop this specialism. And that means including it as an area for people to learn about in qualifying education as social workers, having it as a pathway for continuing professional development, and really encouraging people to think of social work with older people as a great pathway for your career. We need to be talking about social work with older people and advocating for it, and do that with older people so that their voices are at the heart of everything we're talking about. 20 years ago, when I qualified as a social worker, I could not have imagined the practice that we have developed over the last 20 years. And where we are now, able to do virtual assessments, able to put in assistive technology for people, able to work so much more closely with other agencies, able to advocate and work with older people so much better. And I don't know where it will go in the next 20 years, but I believe that social workers need to be at the forefront with older people in shaping the future of older age care. And to do that, we need to tell a different story about what older age is and what it can be for people. I hope that everyone here today will be part of telling a story that is passionate about the lives and the contribution and the aspirations that older people can have. Thank you very much for listening.
Thank you. Thank you so much, Jerry, for that wonderful presentation. Very clear, lucidly. You have outlined what social workers do and what is happening to the elderly, to the older persons in UK. Some of the things were really important to look at. It was really different to know that about 90% of services is provided by the private sector. And of course, even there you have a big role for social workers. That's what we understood from the presentation. And you also outlined the role of the association. And you concluded by saying that the focus of looking at working with older persons, social work with older persons as a specialism, which is something a very important pointer for all of us for the whole series of discussions that we are going to have. Thank you so much for that. Now, we will just look at if we have any questions in the chat box. Participants, dear, if you have any questions, do put them in the chat box while I have a couple of pointers to discuss. Now, Ms. Jerry, you have said that the social work with elderly can be looked at as a specialism. How far in the UK has it developed as a specialism? And how much is the association, British Association of Social Workers, is focusing on that? That's something. Is there a special focus area for the association? And can you also put a finger on what would be the percentage of social workers who would be involving in care of older persons?
Thank you for those questions. So I'll start with the last bit, which is how many social workers actually work with older people. The answer is not very many. About half of our social workers work with adults, but it's a very small group of that works specifically with older people. And that's because most of the local government assessment work and legal work with older people is carried out by people who are not social workers, who are who do not have that professional qualification. So one of the things that we're advocating for is for social workers to be much more involved in older people's services. How far that's happening? It's happening to some extent. I think the profile of social work with older people has grown quite a lot over the last 5 years. Partly that's because of the research work of the group of academics and others who are involved in promoting social work with older people. Partly it's because our chief social worker for adults in the government had a particular interest in social work with older people. And it was the Department for Health that funded the capabilities statement for social work with older people. That statement is helpful for people for social workers to think about becoming, to wanting to work with older people. It's also helpful for thinking about their continuing professional development and the capabilities that they would need. But it's not a set pathway yet in England or anywhere else in the United Kingdom. What I would really like to see is that within every qualifying course, there was a focus on older people. At the moment, we teach the whole of the life course, but only some universities spend particular time on social work with older people as a kind of as something in its own right. And then I would really like it if more people chose to become social workers with older people and carried out more professional development. And the Association of Social Workers provides learning and development events to help people who work in that field to develop their practice.
Okay, thank you. Now we have some questions in the chat box coming in. There's question from Supriya, who was asked, please highlight how do you take care of senior citizens, those who are with dementia and Alzheimer's?
So we have a lot of, as I've said, a lot of older people who are living with dementia, and they have the same legal rights and the same entitlements to care and support as everyone else. The same, so they would go to the local government in the same way for an assessment and to look at what care and support might be available. We would often have a social worker working with those people rather than somebody who wasn't a social worker, because it can be more complex to understand what they want and what would be best for them. And that would involve using the Mental Capacity Act to help make decisions in their best interests if they're not able to express what they would want. We have specialist services, health and social care specialist services. The specialist services for social care would include particular care homes that have a registration to work with people living with dementia. And actually, of the people who are in care homes, many of them do have dementia. That's one of the reasons why people might need to go into a full-time care home. In terms of what practice looks like, a very helpful put into the chat, and that is a website that was developed by Research in Practice, which is about social work with people with dementia. So I'll put the link into the chat, and that hopefully will be useful for showing you what practice might look like in the United Kingdom.
Okay, thank you. Something similar is from Viveka, who's asking, how is a social worker involved in palliative care? Yeah,
there is a group of social workers who have moved into that specialism of palliative care. Usually you would do that if you've been qualified for a few years, and the posts are generally either in hospitals or in hospices. And so a palliative care social worker would work within a multidisciplinary team and would support older people around their social needs and also their psychosocial and spiritual needs, and around bereavement and loss. So there is work that's been done by a group of palliative care social workers in the United Kingdom called the Association of Palliative Care Social Workers, which sets out what social work at end of life looks like. And that might be a helpful resource as well. So I'll share that in the chat too.
Thank you. There's a question from Mr. Jagannathan Swaminathan, who's asking, how do you see the contribution of UK in this field going to the global level, especially developing countries? Probably if you have to add some more things to it, have you developed certain models of care of older persons which could be used in developing countries also?
I think we have to have some humility in what we might contribute, because we're by no means expert or perfect at working with older people. We do have many services, and I think some of those services are really useful to share learning from. I think there's two things that I would really want to share from the United Kingdom. The first is the law and policy that we have. I think the Care Act and the Mental Capacity Act and the equivalent law in the the four nations of the United Kingdom is quite helpful. And the second is the practice, the way that social workers build relationships with older people and work in safeguarding and work with complexity. And that I would hope we can share more through developing research and being able to say, this is what happens and this is the impact of it. We do need to recognise that our social work is still quite individually focused. And we're not good enough yet at really involving the community. I think we can learn a lot from other countries about that. And in terms of the role of the Association of Social Workers in the United Kingdom, as a member of the International Federation of Social Work, I think we should be working very closely with all of the nations to advocate for older people, to recognise, for example, the United Nations Day of Older Persons, to support the Sustainable Development Goals, which will make a big difference to people's older age. And so BASWA, as the UK member, tries to really support the International Federation of Social Work in those areas.
Okay, thank you. There's a question from Teddy Andrews. He's asking how or to what extent do the social workers engage family members in promoting well-being of older adults?
So we have a legal responsibility when we are carrying out an assessment to involve the carer, if there is a carer, and anyone else that the older person would like to be involved. And that allows a really broad definition of family, and to really understand that somebody's friend or somebody's neighbour might be family to them. I think that we also have to respect older people's wishes, and sometimes they don't want people to be involved. But we would always try to bring a network together. There's some important elements as well around working much more closely with communities to support people. So making, for example, dementia-friendly communities where the shops, the local people, the neighbours understand how to support someone who might be living with dementia in that area. A second thing that's very important is to help older people prepare for maybe not being able to communicate their wishes by encouraging them to have somebody who has power of attorney, so to nominate someone who would make decisions on their behalf if they can't make decisions. And that's something that we're encouraging adults to think about before they need it. And a third element that I think is really important is making sure that where there's competing concerns, so for example, a carer who's worried about someone and an older person who wants to be independent, that both parties have good advocacy, and that social workers work really well with both parties. An interesting development in that area comes from New Zealand, which is being used in Scotland, particularly in the United Kingdom, and that's family group conferencing, where you would bring all the family members, including anyone who's defined as family, friends, neighbours, etc., together to talk about what the older person, with the older person about what they would want, and to discuss together how they can support someone, so that it's not the state that's making all the arrangements, but the family themselves, the community themselves that come to the decisions about what would work.
Thank you. Thank you. We are just running short of time, so I'll just conclude with one more question. And in UK, social workers are legally mandated to work in the social care sector. It's not so in the Indian setting, where the law does not support that only social workers should work with certain sectors like the care of the older persons. Do you have any suggestions how we can move ahead in this? What is the best way to make the government realize, or the lawmakers to realize, the importance of social workers in the care of older persons?
That's a huge question, isn't it? I think there's a few things that help. I think advocacy, talking about the importance of social workers and sharing what they do, and sharing that in the public, to the public, is one thing that can help. In the United Kingdom, a big difference has been made by having social workers as a protected title. So you have to have a qualification and be registered to be called a social worker. That if you say you're a social worker, that you have a certain standard of education and experience. And I think that that does help with public trust. I think that a lot of the way that social workers become more high profile is by being linked into particular elements of legislation. So, social workers carry out particular duties. That has some drawbacks, because it means that some of what social workers do is defined not by the profession, but by the government through the law. So there's always a discussion to be had about how far the law goes and how much more social workers might want to do, or what they might want to do differently. We do have social workers in the United Kingdom who work independently and who can set up their own services for people, and people who work in charities, for example, who receive funding through the charity to do social work. But I think education and advocacy are probably the starting point.
Thank you so much, Jerry, for that your lecture, as well as the questions that you have answered. Thank you so much for your time and sharing your wisdom here.
Thank you.
Well, we will now move over to our next intervention, next speaker, Mr. Marcus Riley. I'm glad to introduce Mr. Marcus Riley to all of you. He is the executive chairman of Ballycara. Apart from that, he is the past chairman and current director of Global Aging Network, which is a very popular network, and sits on the governing committee for Global Alliance for the Rights of Older People and the UN Stakeholder Group on Aging. He has a distinguished record of leadership roles with international, national, and state-based organizations. And in 2018, he was awarded the Global Aging Influencer Award by Aging Asia. He's also the chair of Australia's Aged Services Industry Reference Committee and has a Master's of Business Administration and a graduate of Australian Institute of Company Directors. He is a passionate advocate for positive aging and for interests of older people. And accordingly, is the author of Booming, a life of changing philosophy on aging well. So that's Mr. Marcus Riley for you. Over to you, sir, for your lecture.
Thank you very much for that kind introduction, and wonderful to be a part of your event. And I especially want to acknowledge Dr. Gangadharan for inviting me to be a part of this discussion. I had the privilege of visiting the Heritage Care Services in 2017 and spending time in Hyderabad with perhaps some of you who are online today. That was a great experience, and certainly enjoyed the sharing and fellowship at that time, and look forward to your event over the next few days, or the next couple of weeks, really, I guess. Thanks very much, Jerry, for that really interesting and insightful presentation that you shared, and certainly there's a lot of alignment in terms of, I guess, some of the themes of what I wanted to talk about today as well. Noting that social care, social work, I should say, in aged care, what we call aged care, seniors care, long-term care here in Australia is still emerging to a certain degree. And I guess the frame in which I want to talk about it today is how Ballycara, particularly as a service provider, engages social workers who are part of our workforce, who are on our team. So probably just a slightly different perspective, but certainly a lot of alignment in terms of what Jerry just shared. So I'll go to share my screen, and hopefully that, I think that's working okay. Yep. Trippy, what I want to share with you firstly is just my belief that all people do have the potential to age successfully. And it's a really firm belief that I hold, and believe it's appropriate irrespective of an individual's age or their health circumstances or social circumstances, that we all have this potential to age successfully. And I think it's an important consideration given the longevity of, or the increasing longevity of so many of our population. And one of the main reasons why I hold that belief is that successful aging is self-defined. So if we went around the participants today and asked, what do you envisage for yourself in later life? There'd be a great range of things that people would mention. There'd be different preferences, different passions, different priorities, and so there should be. And because successful aging is self-defined, then I believe it is attainable for everybody. I'm not saying it's easy to do, but I believe it is attainable. And certainly in terms of our theme today, and indeed the theme of the conference, I do want to explore a little more in terms of why that possibility exists for people to age successfully, the opportunity that we have as providers of care and support to older people, and particularly the role of social workers in pursuing that opportunity to empower people to pursue their potential and to age successfully. So very much want this to be a conversation, so I look forward to your thoughts and questions as we progress through, and obviously we can pick them up and respond towards the end of the presentation. The organisations I primarily represent, as mentioned in the introduction, the Global Aging Network has a presence right around the world, in I think up to 60 countries or more, and it's really a great association of organisations who provide services to older people directly, to other organisations who work with providers, researchers and academics, industry associations, and many others. So it's a growing organisation, a growing network, which really fosters innovation, fosters sharing of knowledge, as well as sharing challenges and ways in which we can overcome what are so often common challenges across the world. And also just picking up some of what Jerry mentioned in terms of human rights issues and the work that's happening with and around the UN in terms of the rights of older people. The Global Aging Network is certainly very active in that regard and very supportive of what advocacy groups are doing, and both formally and informally. And Geriatric, which is another organisation I'm a part of, which is the Global Alliance for the Rights of Older People, which is essentially an umbrella organisation for NGOs around the world to advocate for the rights of older people and engage very formally with the UN. We recently launched a Age with Rights campaign, and that's an initiative that all of us around the world can get behind, all of us who are interested in and supportive of the rights of older people and wanting to see better outcomes for older people right around the world. Ballycara is an Australian-based organisation which provides a range of different services to older people primarily, people who are independent and still very healthy and living at home, through to those who are receiving in-home care, as well as facility-based care or residential care, as we call it here, through to end of life. And personally, I've been involved in the industry for over 25 years and have a genuine passion for the way in which we better support, better empower older people so that better outcomes are achieved by more people across our society. So moving on from there, I have a question for you, which is what age are you? And if I asked everybody to respond to that, if we were in the same room together and people were providing their responses to what age you might be, I would guarantee that 99% of us would respond with a number. Because when we ask somebody what age they are, or if we are asked that question ourselves, we immediately respond with a number, which is obviously pertaining to the number of days or number of years lived. And so many of our perceptions, so many of our societal stereotypes, and so much of the way people define themselves really is based on the number that we give in response to that question. However, I would argue or promote the fact that indeed there are three forms of age. There's our chronological age, which of course is a number of days or years lived. There's our biological age, which is obviously physically how our body feels, and our psychological age in terms of how we feel mentally and emotionally. And one of those three we have no control over whatsoever. And of course, that's our chronological age. No matter how many fibs we might tell or how many numbers we might scratch out and change, we cannot alter our chronological age. But we can really influence how we feel physically, and we can influence how we feel psychologically or emotionally. And the good news is, out of those three forms of age, it's those two which we have an influence over, but arguably have a greater influence over our well-being as we grow old through later life. And I think that's something which we can educate people about to a greater degree. And it's very much another reason why I believe successful ageing is possible for all people, and why we all have the potential to age well and to, as I say, to pursue our potential and to age successfully. The realities of getting older, we'll see some circumstances evolve in terms of our physical health and how our body does feel. There might be chronic conditions, we might suffer from disease at certain times or what have you. But even with those sorts of conditions and circumstances, we have the ability to take initiatives, to pursue initiatives that can help us feel better physically and can support our emotional and physical well-being as well. And of course, there's an increasing range of preventative initiatives that we can pursue, particularly as we get older, to give us the best physical feeling and the best emotional, psychological feeling. So if we hold on to the potential that we all have to age successfully, that successful ageing is self-defined, and that we have this ability to influence biological and psychological age, then I want to explore the opportunity that we have as providers of services to older adults, no matter what those services might be, whether it's accommodation, whether it's nursing and personal care support, allied health, domestic assistance, meals, whatever it might be. We have this opportunity to play a role which I believe is one of empowerment. It's one of empowerment and support to older people so that they can pursue their potential, they can pursue what's important to them, their priorities, their passions, their preferences. And again, if we can hold on to that, that role of ours, of one being to empower and embracing the opportunity that we have, then we can look at some other factors which really can impact on people and how they can be overcome. So firstly, looking at the threats to people ageing successfully. And there's three main ones here that I believe are really crucial, particularly through later life. The first one is negativity, both a negative view that we might have of ourselves individually, but also that the view of others, and as I referred to before, that is often based around number of years lived, that once people hit a certain age, whether it's 65 or 70 or 80, that people become of less value, that people should reduce or stop their participation in societal activities or their lifestyle pursuits, whether that's employment or education and training or other roles that they might play in the community. And really, it's an example of this form of prejudice called ageism, which is so rampant across the world at the moment. And I would argue it's the last form of acceptable prejudice that hasn't really been called out yet. And I think we all have a role to play in that regard. But that broader stereotype, that negativity of others really impacts on people individually and affects their sense of self-worth, the way they view their future, no matter what age they might be, no matter how short they think their future might be, and impacts on people's ability to really reach their own potential. The second one is loss of control. And again, that's a huge issue for people as they grow older, that they may have less choices, they may have less options in terms of where they live, the roles, the activities they can pursue. And we see that then manifest into people making decisions on behalf of older people individually, and often that can happen prematurely. And I think that's an issue that rightly we will hear more and more about from a legal point of view in terms of older people having their rights protected in terms of their independence and autonomy and being able to maintain that control. And the third threat or risk to successful ageing is isolation. And again, it's one in which we are rightly hearing more and more about. We saw in the UK a few years ago the first appointment of a Minister for Loneliness in the British government as a recognition of the threat that loneliness poses for so many people in the community, particularly older people. And it again affects people's ability to engage, their sense of purpose, and sees them become disconnected and lonely. And again, that has very deleterious effects on people's health, as we well know. I think in identifying these three key threats to people's successful ageing, it starts to really highlight and bring into focus the importance of the role of social workers. If we look at those three threats of negativity, loss of control, and isolation, I believe there are three ways to address those threats. The first one being positivity, the second one being planning to help people maintain control and maximise their choices, and the third one being maintaining a sense of purpose through continual engagement with life, engaging with passions and priorities. And when we start to identify those solutions to threats, the ways we can overcome these threats, positivity, planning and purpose, we can immediately identify the role that social workers can play working with older people, with their families, with service providers, to help people plan, to help people recognise the positives and start to develop a more positive mindset, and certainly to develop a sense of purpose or regain a sense of purpose and maintain engagement with their communities, with their families, with society more broadly. So moving on from there to outlining at Ballycara how we approach these areas, and we have a lot of focus on what we call wellness right through our services and through our engagement with all our clientele and residents. And really this commitment to wellness is about empowering people to pursue their potential to age successfully. And again, it really highlights the role or the importance of the role of a social worker in this approach. So the first one is a commitment for us to have a multidisciplinary team. So whether that's providing services to people who are living in our residential care facilities or our what you might call nursing centres or high-level care facilities, it's important that we have a team providing different skills, different knowledge sets, different perspectives, and contributing to a collective outcome, a collective engagement with our residents and with our clients, and of course with their families. And it's recognising that there's not one particular role which will have all the answers or that can do all the jobs or that can provide all the benefits. And clearly we see the social worker as a really important part of that multidisciplinary team. Then a key function of that team, and something we really commit to as an organisation, is to invest time in developing knowledge of the person. And I've underlined there the person as opposed to their condition or their clinical status or their health status, that we want to go beyond that and really understand who the person is. What was their past? What was their family environment? What was their professional background or working background? Where do they live? What were their passions? What's their status now? What's important to them now? And then it's using that knowledge to help shape some future thinking, which again, we feel is very important in terms of people pursuing their potential and attaining a degree of wellness, again, no matter what stage of life they may be at. And it's then using that knowledge to assist the individual in developing or increasing their own self-knowledge, so they're better informed about what's important to them. And through that knowledge, starting to be more optimistic and starting to think more about their future, about their opportunities. And we have a belief that's really important no matter what stage of life people are. So whether you are palliative and end of life, you still have, if there's days and weeks, even hours left, they're your hours, they're your days, they're your weeks. You should be in control of what those days and weeks, what that time looks like. It should be about engaging what's important to you, what your passions are, having the people that are important to you around you. And then obviously if there's years, if there's decades, if there's that longer part of that later life period, then again, it's thinking about that. It's contemplating what you want from that future. What are the relationships that are important to you? Where do you want to be living? What sort of services might you want to access? What sort of lifestyle activities do you want to be partaking in? What are the things that are important to you? Is it your faith? Is it the location in which you live? Being part of the natural environment, being close to water, your preferences for food, all these things that we take for granted every day. But as we get older, those choices can be so often limited and taken away from us. And again, a social worker really brings great value to this process for us. And it's the engagement with people individually as well as working with the collective that we see this value shine through. And to share a couple of examples with you, I'll introduce you to a lady called Mary Therese, who has lived in one of our care facilities for over 15 years. And indeed, due to her personal circumstances, both her parents deceasing and her own health circumstances, she had really no options other than to look for an aged care accommodation, which many people would argue is not ideal, and it's not. But Mary Therese needed the care and the accommodation we could provide. And through the engagement with our social worker, with our multidisciplinary team, but particularly the role of our social worker in engaging at that very personal, relational level with Mary Therese, she has continued to be, over that 15-year period, one of the most engaged, positive people in our community. She continues to work part-time. She is a very strong participant in the various groups and committees and activities that are part of the Ballycara community, as well as her role in the wider community outside Ballycara. She's a very strong communicator, even though she has challenges with her speech and some other physical challenges that she overcomes. Through the engagement with her passion, through her planning, but more particularly her future thinking, her positive mindset, supported and empowered by our team, and again, particularly the role of a social worker, Mary Therese is a shining example of someone who's really aging successfully and pursuing their potential. And I think the aspects to overcome the threats to successful aging that we talked about before, her positivity, her planning, and that really strong sense of purpose are the secrets to her happy life. And again, the very supportive role of our social worker has been key to that happy lifestyle. So just going a little bit deeper in terms of the role of the social workers here as part of the Ballycara organisation. And again, we have services across the home and community spectrum, so people getting a range of different supports in their home, social group services in the community, as well as our accommodation-based services. We have social workers playing a role right through that range of services. Firstly, it's really important to emphasise that the social worker helps us go beyond the physical with our our clients and with our residents. And again, looking beyond the clinical diagnosis, really helping to develop knowledge about the individual and who they are, and bringing their skills into engaging with people individually, allowing people to be open with us and to build that trust so that we can develop knowledge together and then use that knowledge. As mentioned just before, a very key role in terms of positive and future thinking. So obviously the planning skills, the ability to understand the emotional circumstances for people, as well as their physical health and any other health circumstances that may be at play, using the skills to be able to go deeper and understanding the impact of those circumstances on people. Obviously the family dynamics that might be at play, and then really being that facilitator, if you like, that gateway through to a broader network of services, a broader network of providers, of resources that can really add value to a person's life. And it's a model in Australia which I think needs to be embraced a lot more strongly across our industry here. And I've seen it work very well, particularly in parts of America, where the role of the social worker is really the pivotal role in the coordination, the development, the planning and delivery of services to an individual. And I think better recognition of the skills of social workers, their ability to draw on a wider range of resources, really connect with that broader network in order to provide better outcomes for the individual, is one which really can be more comprehensively embraced, I believe. And I think, again, the adaptability of the social worker professionally to lead where necessary, to facilitate the multidisciplinary team, to facilitate the family involvement and other service providers, but also to be able to step back when needed as well, and allow other, be it other health professionals, other caregivers, to take prominence and to play their lead role when it's appropriate. And I think that's a great skill which potentially not all health professionals have the ability to play, but it's one we've seen time and time again, and one that's given great value. Just moving on a little bit further, again, the impact of the social worker roles here at Ballycara. We've seen the deployment of a wide range of skills. It's led to better access for people, better connections, and ultimately improved health outcomes. And I think something which, again, is overlooked in the way services are provided is improving or increasing people's health literacy. So better understanding their own circumstances, better understanding the resources and network available to them, so that their engagement is stronger, their choices are increased, and better results, better outcomes are attained for people individually. But I think those, again, the adaptability of the social worker is crucial in that. The recognition of people's varying circumstances and going beyond the clinical diagnosis to really provide a pathway to more informed choices, a wider range of choices, and ultimately better alignment to what's important to people in terms of their personal preferences, their personal priorities. Another quick example is a lady, Kath, who is in her 90s, has lived in our care accommodation for a number of years, and increasingly was developing chronic pain. She has very poor eyesight, and increasing frailty with her hands and other physical challenges. But again, through the engagement primarily of our social worker, the greater knowledge was developed about Kath and her history and what had been important to her in her past. And one of the things which shone through was in her youth, she was a fine painter and was very passionate about art, but that had been something she hadn't engaged with for several decades. So through that knowledge, and then developing a plan and better future thinking, and through the coordination and facilitation of our social worker, we saw our art therapist engaged. We saw this collaborative effort, and through that, Kath has developed or reignited her passion for art, And to the extent now where she's, with that assistance, she is painting regularly, which has actually seen her now provide her artwork as gifts and donate them to charitable initiatives. And you can imagine the sense of self-worth that's developed for her and seen her increased engagement with life. So in terms of the way forward, some suggestions I would share with you today, friends, around how we can embrace our opportunity and embrace the role of social workers to better enable and better empower people to age successfully. Again, really investing time in developing knowledge of the person. It's just so beneficial, so valuable, and unlocks so much of what we can do with and for an older person, and indeed for them to do for themselves. That value, that importance of thinking about the future, of using that knowledge, that greater self-knowledge to contemplate and think about the future, and hopefully be more optimistic and positive about the potential and opportunities of one's own future, again, irrespective of their stage of life. The adaptability of the social worker as part of that multidisciplinary team, there's great value in that. It's one which isn't utilised and created well enough at the moment, but it can provide great value to individuals as well as to the organisation providing services. Reinforcing our role is to really empower individuals to maximise their choices, to support and enable them to really pursue what's important to them, and to increase their autonomy over and over again. And again, I'll just share with you that belief I have, which is there for each person to age successfully, no matter what age they might be, no matter what their health or social circumstances might be. I'll just share with you too my book, Booming, which was released a couple of years ago now, but it's very much about that philosophy of ageing well, and that what we can do as individuals in terms of pursuing our passions and pursuing successful ageing as we get older, but also the roles that we can play as family members, as professionals, as organisations, and indeed as communities. And there's some links there to the organisations I'm involved with, and I'm just happy to share, of course, further information after this session. And I do want to leave you with a quote which really resonates with us at Ballycara in terms of the role that we see ourselves playing and the aspiration we have for everyone who interacts with us. And that quote is that happiness is the joy one feels in the pursuit of their own potential. We have the opportunity to really empower people to pursue their potential, to age successfully. And I hope that those words resonate with you as well, and that we can continue to share our knowledge with each other so that we can play a greater role, or a more beneficial role, to the older people in our communities and the older people that we serve. Thank you very much.
Thank you, Mr. Marcus, for that presentation on what is happening with social workers, particularly at Ballycara and in Australia. And you started your presentation by saying that we have the potential to age successfully. That's going to be a good term for taking home for all of us, that all of us have the right as well as also the power to age successfully. Thank you for that. And some of the key takeaways are, I think you're focused on the person is important, the knowledge of the person social workers should have, and how it's important to empower because of the focus on the person, and so on the strengths and so on. So and ensure choices for them, which they very often don't have when they are growing old. So that was great. Thank you, Mr. Marcus. And now if we can look at some of the questions. In fact, I would like to start with the question that is based on what you shared is how do we age successfully? Because that we started with the statement of we have the potential to age successfully. And the question goes on like this, that how do we age successfully?
Thanks very much.
Broad question.
Yeah, sure. To me, I think it's connecting the quote I shared at the start, or that belief I shared about the potential, but also then the final quote about the joy people do feel in pursuing their potential or pursuing what's important to them. So I think successful aging is really about aligning to your passions, to your personal priorities and preferences. And so to me, that means engaging with the things that you enjoy engaging with, things that give you a sense of purpose, that give you enjoyment. It's nurturing the relationships that are important to you. And I think it's important in noting that, to recognise that not all relationships are positive for older people in particular, that there can be and right through our lives, of course, there can be relationships which actually have a negative impact on our lives. So it's identifying those that are positive for us and really ensuring we continue to nurture and engage with those relationships. And it's about feeling as though we are in control, if you like, that we are empowered to make choices for ourselves, that we have options. And I think it's important that successful aging isn't defined by physical health, that I can be frail and I can be towards the end of life, or I can be in later life. But successful aging is what's important to me at that time. It's not what's important to my 40-year-old grandson or my 60-year-old daughter, or even my sister or whoever it might be. It's what's important to me. And I think it's really about that defining for ourselves what successful aging looks like.
Thank you. One of the things, one of the threats to successful aging you spoke about was isolation. So there's a question here from Anne Maria, who's asking, what can be done to change this isolation? What are the other factors that are causing this, and how can we change that?
Yeah, a great question. And I think this issue of isolation is one which we are still developing a knowledge about. I think we're better understanding that it is an issue, but the depths of the issue, I think we've got more knowledge to really acquire about this issue. And it certainly becomes a more common occurrence as people become disconnected. And here in Australia is a good example where care in the home is becoming much more prevalent. And it's most people's preference, and it's completely understandable, and it's right to do that. But what we're seeing happens in that living longer in your own home is that you can become cut off. If you're not driving anymore, if you're not working anymore, you may not be engaged with technology, your family may not be spending much time with you, you may not be able to get out in the community, and this, all of a sudden you start to be disconnected, you start to be cut off. And I think also it's understanding the impact of certain developing circumstances. So it might be things like I'm becoming incontinent, so I then lack the confidence to go out in those social environments that I might otherwise have been confident in doing. There might be some other health episode or physical change which sees me start to decline or stop reducing my participation. There might be a change of family circumstances. There might be a death of a spouse, or a change in my local environment. The neighbourhood around me might have changed, which sees me less inclined to be going out and participating and connecting with people. There's a whole raft of factors which go towards this risk of isolation. And again, I think the ageism is a huge contributor to that, where people think because they get to a certain age, I need to stop contributing, stop participating, I'm of less value, less worth. And this has a really huge impact on people's perception of themselves. And that is really commonly leading to isolation for people, and then into loneliness, and it's a negative spiral from there.
Thank you. Ms. Marcus, you were talking about a multidisciplinary team and how pivotal is the role of social workers in that multidisciplinary team. And in certain developing countries where social workers are not even part of a team like that, what would be the best way to progress, particularly for developing countries and even in countries like India? How do we get into it and ensure that social workers have a very important role to play?
Yeah, again, a great question. And to be honest, here in Australia, it's a social worker isn't necessarily commonly part of a team in our industry. Certainly, we've embraced that in the last few years here at Ballycara, and I know other organisations have to a certain degree. I think in terms of if you don't have that professional resource. It's looking at your own processes and methodologies with people, particularly in terms of how we engage with individuals. So as I mentioned during the presentation, it's that investment in time with the person. Yes, we're going to have the health diagnosis, we're going to have the clinical information, but let's go beyond that and let's spend time in understanding who that person was growing up, where they lived their lives, what their occupation may have been, what their family makeup was. And then we start to really understand who this person was, but more importantly, who the person is. And one of the things that we saw great value from wherever possible was spending time in the person's home. And even before people moved into our accommodation, we'd try and spend time with them in their home, because you pick up so much from someone's home environment, the photos on the wall, the books they've read. You can see so much about their history and their personality, their priorities from that home environment. So there's certainly methods we can adopt, no matter what our role is or our background is, to try and benefit from or execute some of those things that can really benefit our engagement with people and the way we empower them.
Thank you. Well, I think we have almost completed the questions. One more question, Marcus, which has come from a person called Shalini. What are the challenges in the field of in-place aging or home care issues for the elderly, with reference to your country, perhaps?
So just to clarify in relation to home care, is that in-home care in people's home?
Yeah, yes.
Yeah, certainly one of the key challenges, as I referred to before, is people, yes, there might be services coming in for certain hours each day or certain hours during the week, but it's how people are coping away from those in-home services. So are they able to engage? Are they able to participate as you would like? Or are they cut off and are they disconnected from the world around them, so to speak? I think certainly the inadequacy of the hours of care is a huge issue as well, that we've got people who are staying at home with higher needs. And the way our system is working at the moment, there's an inadequate supply of care in relation to those actual needs. So that's certainly a key problem, as well as the actual supply of those services. So by that I mean our government controls how many in-home care packages are released and are available to people in the community. And at the moment we have a population of say 3 million older people in the country. We have over 100,000 people waiting for home care services, and they've been assessed by the government to be entitled to those home care services, but the government hasn't released services for them to access. So we have a problem with people waiting so long. And just generally an inflexibility in our system is a common problem and a frustration for those of us trying to provide services.
Okay. Fine. Thank you so much, Mr. Marcus.
My pleasure. Thanks for having me.
Also for answering the questions, and also for those who have raised the questions. Thank you. We will now move to our third and final session by Dr. Henglian Lisa Shen. I'm glad to introduce Dr. Shen, who is a social worker, gerontologist, lecturer, and the Deputy Director of the Centre for Social Work, Innovation and Research at the University of Sussex, UK. Dr. Lisa's research profile is centered on the policy and practice of long-term care, which includes quality of life of older people and their carers, care service evaluations and development, and the care workforce within the long-term care system. Dr. Lisa has many publications of cross-national and multidisciplinary research in social policy and social care practice on aging care. And her latest research is focused on technology, aging care, and social work pedagogy. That's Dr. Lisa Shen for you. Over to you, Dr. Lisa, for your session.
Thank you very much for a very generous introduction, Raja. So before I start, just technical questions. Can you allow me have access to share my slides, my screen, please?
We'll do that. We'll do that. Yeah, we'll just give you a minute. Just give us a minute.
Okay, thank you.
Prabhakar, can you do that?
Okay, let me try.
Yeah, just going to take a minute. Yeah. Prabhakar, can you do that?
It's at your screen.
Yeah, 1 minute.
It's your screen.
Yeah, 1 minute. Just okay. He's going to give you. In the meanwhile, you start. We'll give you the host status. Is it, Lisa? We will give you this. We'll just give you a minute's time. In the meanwhile, you can start.
Oh, okay.
Okay, just a minute.
Okay.
I said he will show you. He will show you. He will show you so that you are not at a loss on this. Yeah. Prabhakar,
So
can you give her the? Can you give her the? Sorry. Yeah. Prabhakar, you coming?
Yes, I'm just giving, sir.
Yeah. Okay. Sorry, Lisa, for a minute.
Thank you.
We have some hassles
and I
here.
also need to apologize from my side because I have a young family. My kids is very little, and it's a school holiday. So maybe you will hear the noise.
We would like to hear them. We would like to hear them along with your talk.
Yes,
right, great.
You can share
I can access now.
Yeah, you can share the screen now. You can share the screen.
Yes. Okay, let me do the slides presentations. Okay, thank you very much. So thank you very much for inviting me to share my experience and the knowledge with well, several hundred people, which I'm so privileged to do so. So, and I think I'm quite grateful to be the third presenter after Jerry and Marcus, because I can see that we do have some overlapped. So that is a good news in a way, and also that's I hope I can able to contribute to something different on top of the similarity from the previous presenter too. So today I'm going to talk about link to Marcus' presentation about successful aging, and move on to talk about the more technology side in terms of how social worker can contribute to the technology development. So let's have those two things are based on my two of my projects. So the successful aging is done about 15 years ago in terms of international comparisons between 3 countries. And the connected care is something that I just completed the project in the UK. So first of all, I'm going to talk about 15 years ago. That's while I was still a PhD student, and also the social worker too in local authority. I was a practitioner full-time and did my PhD research part-time. I was really struggled to understand about what I've been asked to do in practice on the front line. So that was my rationale to carry out my PhD studies as regard to want to know about why, because I'm not English, as you can hear and you can see. So it's quite not always easy to understand the English culture and the English expectation in terms of how social workers should work with old people. So I want to know about how the different countries, in terms of their welfare ideology, their culture ideologies, impact or influence on aging care in social work practice and aging care in general, overall. But also talking about, want to know about how those ideology impact and embedded into the day-to-day practice of aging care. So that was my rationale. So I choose 3 countries. One is England, where I was working and where I'm still working in. The other one is the Netherlands, and the third one is Taiwan, where I came from. So the reason for choosing those 3 countries for my study was, for the UK, if we're talking about the welfare ideology using the Espin-Anderson's welfare regime framework, England is have a medium to high demand of aging care because of the demographic trend. So the Netherlands is medium, but in Taiwan and in East Asia, including India and China, I think we have very high demand of aging care because we have a higher percentage of aging populations. So the differences between those 3 countries also as regard to the informal carers. Informal carers, what I mean, are including families, are including friends, are including neighbors and volunteers. So in England, this kind of level of support is medium to low. In the Netherlands, it's quite low, and in Taiwan, it's medium. For formal care, is in relationship to the informal care. Formal care is like social worker, like us, for example. Also like the healthcare system, for example. So the UK is in the median level. In the Netherlands, in contrast, it's very high. And in Taiwan, it's very low because predominantly the care support has been done by a family in Taiwan. So that link to explain public and private care support to older people in England is medium public care in kind like home care support, residential care support, nursing care support, or in cash, like paying, calculate the care needs into the cash and paying money to the older people and their family. They arrange the service by themselves. In the Netherlands, this kind of public and private support is very high, and in Taiwan has been increasingly high in terms of public support, but still predominantly aging care has been provided by private. And that is also explained about the care market, the pluralism mixed economic of care market. In England, it's predominantly private sector who provide the direct care to older people. Social worker in England, our key role is to do with assessment, identify the needs, and as the gatekeeper in terms of assess the eligibility for the public funding in terms of aging care. In the Netherlands, it's a low public sectors in the care market, but high non-profit sector to provide home care, nursing care, and the residential care. In Taiwan, it's a mixture of a non-profit and for-profit sector. So this is all about the differences in terms of ideology of welfare in those countries. That while the Netherlands has more public support and also more generous in terms of supporting the aging group, is that they have a social democratic ideology of welfare. They see old people as citizens, as everybody else. So they are promoting older people to live as normal in terms of the normal of their own term as citizens. It's their right to live well and live meaningful and receive the support they needed publicly. And it's the country's responsibility, national responsibility, to care for older people in the Netherlands. In England, the ideology is more selective in terms of the eligibility criteria as regard to who deserve and who entitled to receive a public support, including social workers' support. in Taiwan is really much very family-based, and this kind of family-based culture is not only relevant in East Asia, and I think Indians is similar this kind of culture too. It's also applied to South Europe, and East Europe as well. So those ideology has shaped the aging care's development and practice. So my research is about using the social work, English social work principle about person-centered. So I start with older people in the center, and I include old people who live in their own home and old people live in residential care home, nursing care home, and radiating out to their care professionals and the local government administrators, and then the national level in terms of the national civil servant and the NGOs. So this was my framework for my research applied across those 3 countries. In total, there were over 110 participants or interviewees I has been interviewed. So those people teach me about what is successful aging. It's pretty much similar like what Marco just presented about how to aging successfully. I'm just using different phrase, that's all. So in order to aging well, there are 2 elements, key elements applied, and they are interlinked. One is the quality of the life of old people. The other one is quality of care that older people received. So what I mean by quality of life, similar like Marco say about older people need to feel in control. But what I mean by in control is that autonomy does not mean that older people have choices. In England, often old people have choices of saying yes or no. This is not autonomy. Autonomy is about older people are able to voice their views, but also able to exercise their views to make what they said happen. That is what I mean by autonomy. It's beyond in control. Quality of life also includes what Marco said about isolation. But for me, isolation is different from loneliness. People can be happily isolated. Some people don't want to have people around. They just want to be quiet in their own room, in their own space. But it is not acceptable of people feeling lonely, because feeling lonely is about depression, and the feeling lonely, a lot of research has conducted in the fact that loneliness have a great impact on multiple health illness, especially like cardiovascular disease and other disease, which will be health deterioration, has closely linked to loneliness, feeling of loneliness. So quality of life in the social inclusion for me, from what I learned from our participants, is about the social engagement in a meaningful way to them individually. And that is what we mean by social inclusion. But the bottom line is about the basic human survival in terms of care support, like personal care support, bathing, eating, get out of bed, shower, and get into the bed, but also about healthcare treatment and healthcare maintenance. So that is what we mean by quality of life. Quality of life can be possible to exist without quality of care, because people can work alone, and social workers play a significant role in this block of quality care. And what I mean by resources, they are including the carers in formal and the formal carers. They are the resources in terms of the quantity of those carers, but also in terms of quality of the cares. So we know that the aging population, a lot of countries are in an aging society now these days. So demographic trend is become not balanced. There are more old people and the lesser care are available formally and informally. That's what we mean by numbers. But the quality of a care staff, informal and care formal, is about their knowledge of how to provide the care and how to support old people. So in terms of those balance also means that there are great importances of a well-being of those informal carers and the formal carers, because we know, or we have seen in England in particular, there are a high rate of a turnover rate. People got sick. For those carers, people easily got sick, and people are, many people are left the job. They don't keep the job for long. This can be quite problematic too. Partnership is another element of quality of care, because the care system is very broad, especially for aging care. Aging care is involved with, if we want to provide the care comprehensively, see the person as a person. It's not only about social care, it's not only about health care, it's also about leisure, and later I'm going to talk about technologies. All those elements, all those type of care involved with multiple people who providing those care, those knowledge, those skills, and those contributions. And that's what I mean by partnership, also including social policy and policymaker, of course. So from this framework, we have found, or I have found, that in England, those personal care and health care is only provided to high dependent people. The threshold of eligible to receive the local authority public fund care is very high. In comparison with the Netherlands, it's quite personal designed. It's very person-centered. It's really person-centered, the Netherlands, Dutch models. They see person as a person and value the individual. And in Taiwan, it's about personal designed institutional. So it's largely done by institutional care with a big scales, like residential nursing home in Taiwan, normally working in partnership with hospital, for example. So in terms of social inclusion, social engagement in England, it really depends on self-reliance. In England, there is a strong expectation and a culture about independencies. And I think that can be debatable what we mean by independencies, because from my practice and from my research, I often found independencies is that old people have to be very independent. But I will argue that independency is about old people being independent with sufficient support. They can't be independent all by themselves alone. In contrast, the Netherlands have a various choice because of the ideology about citizenship, ideology about provide or promote the normality of the persons, meaning of normality. In Taiwan, it's pretty much focusing on the health promotions or about healthcare. In England, the autonomy is about old people do have a right to complaint. In England, social work, for example, we do have a complaint procedure that people can have a channel to complain. But yeah, but in the Netherlands, strong old people pressure group is quite active in practice. And I'm quite amazed to see, even in the residential nursing care home, that old people tend to be quite frail. They do have a client board. All the people, they sitting together and they provide, exchange their experience and the governance, the care they receive. This is kind of able to express their view, but also able to exercise their view. That is one of the examples I'm really impressed what I found in the Netherlands. In Taiwan, it's much more strong family influence. Family have a very big say and a big influence in the care provision and the care arrangement, care decisions. Resources-wise, in England, public underfunded, which is continuing a challenge, and the short care workers is continuing a challenge. Similarly, the Netherlands have a significant budget cut. However, in the Netherlands, they have a highly professional formal care workforce. Even though they're home carers, even though they're care workers in residential and nursing care homes, they are very rigorous, being trained with a very clear projection of their career development to sustain their care workforce. In Taiwan, is increased state support and increased professionals. So you can see that in Taiwan is catching up with Western, but the Western is also trying to mirror the East challenge as regard to the public fund and also about the care workforce. What I found the most another thing I found interesting is about how the system works from top to down or bottom to up. In England, it's much more to do with top to down, national, top to down to local. And there is an English phrase called carrot and stick. If a local doing well, they got rewards. If they don't do well, they've been punished. Yeah, so that is an English phrase of carrot and stick. The Netherlands is much more equal partnership with including everyone in the care system from top to down and also within the same labels. And in Taiwan, it's top to down and the bottom up approach. So that has told me that partnership, working with involve all the relevant people who care for old people and contribute to aging care is very important if we can promote aging well to our populations. So I'm moving on to my recent project, which I has completed. So with this kind of principle of a partnership, but also with the social work principles of promoting person-centered focus on individuals' need and promote the meaningful life according to the individual, but also about relationship-based approach. That is something very highly promoted in English social work practice now these days. That my project about technology has included 5 care homes in my local areas where I work, and 4 technology companies, and it's been funded by the biggest founder of social science in England is ESRC. So the rationale for this project is about care home, and the rationale is about care home are increasingly challenged to rising of people who have dementia in England. Overall, there are over 60% of population who live in a care home have dementia. So although the innovation is associated with better quality of care in terms of technology, but they are very seldom that technology actually is person-centered. I think, I'm not quite sure about your experience. I take time to learn how to use a Zoom. I'm fitting the technology rather than technology fitting into my day-to-day life. So that is not really person-centered according to social work principle, isn't it? So also about the staff shortage is really problematic in English care now these days. So for those reasons, we have decided that I want to focus on technology development and using the social work principle in terms of person-centered, in terms of a partnership, in terms of relationship-based, but also in the social work role. One of the strengths social workers are very good at is about what Marco said about coordination, and it's about facilitation to draw everybody together. But in English term, we also valuing people experts, we call experts in experience. So everybody in the care system, we do have our own expertise. Doesn't matter whether we are health, whether we are social, and now including technology. So our research team is a multidisciplinary team. I play the significant part because of a social work background to link everybody together. But also I know quite well about old people and their family. We also have professor in engineering. We have a professor, we have a doctor in the gerontology, and we have a business expert in our project to support technology company.
Dr. Lisa, sorry to break in. Would it be possible for you to conclude in 5 minutes or so? We're running short.
Okay, yeah.
Thank you, thank you.
Thank you. So the study aim is to investigate existing digital technology in care home and gain better understanding of the challenge in providing dementia care in care home, but also identify the potential solution. So this is pretty much drawing from the social work principle. That's what I just said in terms of instead of the power imbalance about the classical research is about a researcher generating the knowledge. This project is pretty much focused on co-design, everybody's own experts in terms of their experience, in terms of their knowledge. For social worker like me, the researcher for social worker background is to facilitating everyone contribute equally and being valued equally in terms of their knowledge and their experience. So we involve with the care home staff and the care home residents and the care home's families. We gather in their experience, their knowledge, and we fed back our findings to the technology companies for them to propose their solutions. After that, we all gathering together to discuss further about what are the priorities in terms of technology development to enhance the care. I have to emphasize technology is not replace the human context and the human relationship. It's to enhance the care. So the need for the care home staff, people want to take time to do the care that is meaningful, what we call care. They don't want to do the bureaucratic work, key in a lot of data and stay a lot of time in front of a computer. So that is the main message from the care home staff. They want to spend time face-to-face, have direct contact with the care home, with the older people. So in terms of older people and their family, they want to keep in contact with their family members. Oh, sorry. They want to keep in contact with the family members. So the privacy in terms of a contact channel is very important and is a great concern to them. And also about affordability as well. So a lot of technology has been input into the care home during the COVID pandemic. So one of the key arguments is that there are too many technology, there is no synergies. So the staff normally often need to take a lot of the technology equipment while they are providing hands-on care to old people. So that is something that need to be considered. So my final slide is about, with this kind of valuing everyone's expertise, but we need to know who are the everyone though. So the people in the system's expertise and ensure everybody's voice being heard and able to exercise their choices and their voice is that most of my partners in this project feel satisfied with the co-creation process, and over 50 of our participants feel very satisfied with this kind of inclusive partnership approach to identify aging care's needs and identify the way forward. So better co-design technology where end user, which means old people and the care home staff, are the center of the process. And that will be able, hopefully, to ensure that the technology actually is meeting the purpose of people's day-to-day life and the day-to-day work. A shared vision and a commitment across a local authority and the wider social care to be more involved, and that is from my participants in the project in terms of NHS managers and the public health managers. Privacy and autonomy are a very important factor in terms of technology adaptation, and I think that applies to any care provision as well. There is a lot of a blur between public space and the private space in people's own home and in care homes as well. So that's it from me. Thank you.
Okay. Thank you so much, Dr. Lisa, for within the short period of time, you were able to give a good overview of particularly 3 different regimes of aging care, which was great for us to understand how they are different. And there are also certain similarities among them. On the whole, today, I think we have understood a good perspective. We have got a good perspective of the role of social workers and what social work can do from a variety of perspectives. I think we have looked at research, particularly Dr. Lisa has focused on research that can be done, and probably in our own countries, we can look at these as a model. And we also looked at what social workers do, particularly what Jerry said in the beginning of social workers focusing on vulnerable within the older persons group. And Ms. Marcus focusing on how we need to empower and focus on the person, not only vulnerable, but also focus on everyone as people. And then, of course, I think Dr. Lisa ended with the importance of autonomy over everything. So I think we have had a fantastic overview. Thank you so much. We don't have the time to take questions right now. I'm sure we will be able to answer later on. In the subsequent sessions, I'm sure all of these questions could be answered in a variety of ways. And thank you, Ms. Jerry, for particularly answering in the chat also. And all those who asked questions, thank you so much for being a good participant in the event. And a big thanks to Ms. Jerry, Mr. Marcus, and Dr. Lisa for sharing the wisdom within the short span of time. Thank you so much. And now over to Dr. Gangadharan for any other comments and winding up.
Thank you so much, Dr. Raja Samuel. Wonderful. You chaired this very important session. Yes, probably you could have had some 10 more minutes for Lisa. So you could have had some more questions to her, but we couldn't help it.
Sorry,
but
I'm
let me tell you, it's been
about
wonderful.
Jerry, so I can talk forever.
Yeah, but Lisa, we'll come back to you once again for another session a little later. And I'm very sure that with Jerry, kicking off so well, very elaborate discussions, and as usual, Marcus, who absolutely excelled. What I think I've been hearing him now and then at both in person, also outside, he's given us a lot of inputs. I was very impressed with the way that he defined the role of social workers, though Australia, I've been using them for the last few years of time. I think 3 of you giving us so much of inputs. And I'm very sure that people in India, particularly India and other countries as well, social workers' role can be made more useful, more relevant to the elderly. I would like to definitely thank all the 3 of you, and also all the participants who have been in big number from all over. We would like to thank you. And we would start the session tomorrow at 11 o'clock, like what we did today. So this will be the session for 29th and 30th as well. If there's any announcement, we'll do that. I think a lot of you, chat box has been full with a lot of questions and a lot of deliberations. And I'm very sure we will try to use it. We will try our best to use them. And quite a number of people have said that they'd like to have the presentation. We would like to definitely share the PPT with them. Please write to us when you want the PPT. Sending in a chat box also become a big challenge to us. Those of you are really wanting to use them, please feel free to write to Heritage Foundation. We'll be very happy to share with them. I think feedback form will now come. Kindly bear in mind, the feedback form for 6 days have to be filled in for us to issue certificate, otherwise you may not be able to give a certificate. I think with this, once again, I'd like to thank all of you for being part of us. See you then. Thank you.
Thank you, sir.
So we are not
Thank you.
closing it down because, yeah. And Prabhakar will now share with you the question. Yeah.
I'll close it, sir. You please.
Prabhakar, have you given that?
Yes, I'll share. Already shared, sir. I'll close that after.
Wonderful. Okay, wonderful. Okay, take care. Thanks, Dr. All of you. Take care. Thanks. Nice seeing Lizan there. Nice seeing Dr. Mangaleshwaran there.
Sir, yes, sir. Thank you, sir. Thank you, sir.
Nice seeing all of you. Nice seeing all of you.
Thank you. Thank you.
Thank you. Pleasure. Ghosh,
Thank you,
how are
all
you?
of you.
Mrs. Ghosh. Nice seeing all of you. Yeah. Yes, Prasanthi, you came in. Good.
Sir, where feedback form give you?
Sorry.
Sir, where feedback form give you?
It's there on the chart
There's a
box.
form there. Go to the chat box and fill it up. Just fill it up. It'll automatically come to the chat box.
Okay. In this chat box?
Yeah, it's there in the chat. Link is available in the chat box. You please go through the chat box.
Okay, sir. Thank you, sir.
Thank you.